My name is Dr. Peter Yellowlees. I'm a professor of psychiatry at UC Davis in Sacramento, California. And today I'm going to be talking about telepsychiatry, in particular about the future directions and the sort of research that we're doing on telepsychiatry here at UC Davis. Now, this is how we traditionally work, and I've been providing consultations using video to rural areas in both Australia and in the USA for over 20 years now. Currently I have a practice across Indian health clinics, and I see patients there most weeks. And you'll see here in this picture of me that I'm talking to some actors, in fact on this screen, normally a patient, and then I have another couple of screens where I have the electronic record and any other information that I want. So I essentially deliver paperless consultations into primary care clinics around the state. And this is how we've traditionally done telepsychiatry. It's very well accepted. Patients really like seeing their doctors like this. We're really very well organized in how we deliver these services. Having said that, there are things that we want to do to improve the way we work. And so we've got a very active telepsychiatry research program going on, and have been successful in gaining quite a number of both federal and local grants. What we're trying to do is look at how we can provide more accessible and efficient, cost-effective, patient-focused, collaborative care. In other words, care with primary care. We're trying to make the doctor-patient relationship more flexible by having both doctor and patient able to communicate online much more than they would do normally, particularly moving to a sort of hybrid type of care where we see patients both in person and online. We're comparing in-person care and synchronous telepsychiatry with what we call asynchronous telepsychiatry, and I'll explain that more in a minute. We're seeing patients who have their first languages different from English, particularly Spanish patients, and we're using the asynchronous nature of the internet to be able to translate these consultations and thereby give better access to care for people who might not be able to find providers who speak their own language. And we're ultimately aiming towards patients developing and sending in more of their own data and video to us. So what is asynchronous telepsychiatry? It's really very straightforward. We have a setup whereby we work with the patient to record a semi-structured clinical psychiatric interview. That video and the history from the patient's notes is sent securely to a psychiatrist, who then reviews that, sends an opinion back to the referring provider. The provider then discusses the psychiatrist's recommendations with the patient and implements whatever they wish. A very straightforward process from a technical point of view. Here you see the setup. We just literally use a laptop. We have a clinician here talking to a patient, and we record the video onto either the laptop or send it directly through to our servers. We obviously keep all of our notes in our electronic record so that this whole process is completely electronic. And we've done a lot of research now over the last few years on this, with several different funded studies that have been published in quite a number of major journals. What have we found? Well, this slide shows the core findings, but you also see me doing a telepsychiatry consultation here. And again, you can see that I've got a video on my laptop, which I am watching. At the same time, I'm able to review the patient's notes, and in the third screen I literally write my own consultation note whilst I'm doing all reviewing of the video. Now, we've found that asynchronous telepsychiatry is diagnostically reliable across differing language groups, with translation in between. We're not suggesting this for therapy, but we are suggesting that it can be used for monitoring treatment. It's been very much easier to organize. One of the big problems with traditional telepsychiatry is that you have to literally organize a whole group of people to meet from two different places at the same time. And here, you're all in one place when you record the interview. And we've also found that it dramatically improves communication between the referring doctor and the psychiatrist. And sometimes they go back and forth a few times on email or secure messaging after the consultation has been reviewed. Now, one of the things that this has led to has an increasing interest from our perspective on the issue of language and interpretation. because we're obviously seeing quite a number of patients, particularly for asynchronous consultations, who don't speak English. This is a significant problem in America, where 4.7% of the US population have limited English proficiency. In Sacramento alone, we have 90 non-English languages that are spoken, and professionally trained interpreters are often simply not available in community-based practice. We also know that if you fail to use an interpreter, that patients actually have increased hospital admission rates, more tests done, poorer patient comprehension of what's going on, and misdiagnosis and improper treatment. So the issue of interpretation is very important for this 5% of the US population. And what we're trying to do is use technologies to improve this. So on the screen in front of you, you see an example of one of our asynchronous consults where we've managed to put on both the automated English language and then a Spanish translation so that a reviewer can review this in either language. We've been experimenting with Google Glass, and here you see myself and Dr. Stephen Chan, who's one of our residents here, working with Google Glass, talking to each other. One of us can speak in Spanish, the other in English, and then we can pick up those languages on the actual glasses and respond. Alternatively, we could use smartphones, and here you see the two of us doing exactly the same thing with smartphones. I'm able to speak in English, it comes up on Stephen's smartphone in Spanish, he's able to read that, reply in Spanish, and his reply comes up in my smartphone in English. So very simple but quite technically complicated things to do. So where are we going with all of this research? We're being very fortunate, quite honestly. We've managed to obtain 3 more grants in 2015 alone. So we've got a big project that Dr. Lauren Scher is managing, looking at how we integrate asynchronous consultations into primary care. I'm working with Dr. Glenn Jiang, and we're doing a study essentially in nursing homes, again, of asynchronous consultations. We think this is going to be a very big deal in the long run because there's a huge need for psychiatric assessments for patients in nursing homes, many of whom are essentially on too many drugs and need psychiatrists to review their medication regime and simplify that. And then thirdly, we've just obtained a grant for myself and Dr. Stephen Chan, looking again at this automated translation process that I was talking about earlier on. We're trying to do more of these asynchronous consultations in other specialties apart from just psychiatry, and we see ultimately patients recording their own interviews. We've actually done this with some of the patients here at the Mind Institute, where we've had parents record interviews of their children and record their children actually showing behaviors that they exhibit in the home, and then sending those videos into their doctors. Ultimately, of course, this is all going to go to the phone. We're going to be using these sort of systems on smartphones and applications on smartphones, and we'll be doing it within closed social network environments. So we're also looking at those. Now, this set of work, which I presented very briefly here, involves a large team. There's a long list of names here from across UCD and several collaborating centers. And we're very proud to be working with this large group of people who are doing a fabulous job. So I want to finish up by thanking you very much for watching this video. We're delivering care now, increasingly in the way that care is going to be delivered in the future, both in person and online. One of the key issues is that we investigate this, we research the best approaches, both clinically and technically, and we make sure that we deliver that care really well.